A deviated septum is a condition which occurs when the wall between your nostrils, known as the septum, becomes displaced to one side. This causes one nasal passage to be smaller than the other and in severe cases can cause serious side effects. Having a slight septal deviation is fairly common, and many people who have some kind of deformity to the septum may not experience any side effects. However, for those people with a severely deviated septum, symptoms such as nasal obstruction, nosebleeds, facial pain, and recurring sinus infections can occur. If these symptoms are disrupting your life, it may be time to visit your doctor. In general, a deviated septum is either caused by a defect present at birth or else by some accident or trauma to the nose. A car accident, playing contact sports, or simply slipping and falling are all common causes of deviated septums in both children and adults. If you've been involved in such an accident and have noticed potential symptoms of a deviated septum, you should consider visiting an ENT clinic. When you do visit an ENT doctor, he or she will ask some basic questions to understand the nature of your condition. Common discussion topics will include the length of your nasal symptoms, the presence of nosebleeds, your history of sinus conditions, as well as nasal trauma, your current use of decongestants and other medication, and the overall severity of your nasal obstruction. Being prepared to answer these questions thoroughly will help your doctor make a diagnosis. If you do receive a deviated septum diagnosis, fortunately, there are various safe and effective treatments available. For milder cases, initial treatment may consist of medications like decongestants, antihistamines, and nasal steroid sprays. While these can help manage your symptoms, they ultimately will not fix a deviated septum. For more severe cases that do not respond to medications, a surgical procedure called a septoplasty may be suggested by your doctor. In this procedure, the deviation on your septum is corrected through a straightening and repositioning process. This is a safe and routine procedure that can often completely resolve the symptoms of a deviated septum. If you believe you may be suffering from a deviated septum or any other nasal issue, it's important to visit a doctor as soon as possible. If you're located anywhere in the DFW area, the team at Central Park ENT is here to assist with any ear, nose, and throat conditions you may have. With 3 locations in Dallas, Arlington, and Fort Worth, our team of experienced and compassionate physicians and practitioners is standing by to provide you with the highest standard of medical care. To learn more about Central Park ENT or to book an appointment, please visit us at www.centralparkent.net and fill out the form on our website.